1, 2, 3.
Well, good morning. Welcome back to the Broadcast Retirement Network. I'm Jeff Snyder. This is BRN AM for Tuesday, May 2nd, 2023. And our top story today, veterinarian shortage. Pet owners need access to telehealth. And joining me now to discuss this and a lot more, David Lee is the Associate Dean at the Cornell University College of Veterinarian Medicine. David, great to see you. Thanks so much for joining us on the program this morning.
Sure, happy to do it.
All right, David, I've been reading a lot of studies, we've been reading a lot of studies that say that there may be a shortage of veterinarians to care for our furry, lovable friends. Want to get it from the horse's mouth, pun intended. What do you say to this? Is there a shortage of veterinarians in the U.S.?
Yes, I think short answer, yes, but it's complicated, as you might expect. It's not necessarily nationwide. It's not necessarily there's a lot of different types of veterinarians, so there's a lot of different parts to the sector. There's specialty care, emergency care, primary care, which is probably the veterinarian that most of your audience interfaces with the most. Large animal, of course, so food animal, equine, all of that. And so I would say definitely there are regional shortages, but there are other places where maybe it's not as bad, not across all types of practice. And we're still trying to get a handle on whether this is still a short-term temporary situation because of the pandemic. There's certainly some precipitating causes that came out of the pandemic. Some of those might be correcting now, even as we speak, but there'll probably be some longer-term ones too that we're working to counter as a profession. So.
And what, you mentioned COVID. Is it maybe why would there be a shortage? Is people didn't have the funding, they decided to take a step back because of the pandemic and they couldn't go in person? Why potentially is there a shortage in certain disciplines?
Yeah, so that was, well, if we back up, even a year, certainly 2 years in the pandemic, of course, a delivery system that's never been super efficient compared to maybe human medicine. All of a sudden, the pandemic, not having clients in our waiting room, they're in their cars, and then having a fraction of the staff able to work at any given time, and not knowing how many people are going to be there tomorrow, right? If somebody once we got tests, of course, they test positive, they can't come to work for 10 days. So it's not dramatically different, I don't think, than we've seen in other sectors. You go to fast food, you go to a restaurant, you go to a store. We saw that kind of everywhere. But there are a few things maybe a little unique to vet med. One, there is evidence that more people adopted animals during the pandemic. They're working from home. Yep. So it took us a while to really grasp that, but it's since been shown to be the case. The economy though was pretty good going into the pandemic. People had a little more money. They weren't spending it on travel and some of the other things, so they're spending it more on their pets perhaps. And then things got backed up, right? They knew the dog needed to be seen for this or that. And now all of a sudden they can't get in for months, and so it backs up that much more. Same time, we had quite a few veterinarians and veterinary technicians, which are nurses, if you will, especially our technicians, finding more profitable jobs, more jobs that pay better, and quite a few veterinarians that chose that time to retire. The retirement finally doing well. Many of them own practices that they sold to corporate consolidators and did quite well. And so we lost some people from the profession for sure, demand greater, and the efficiency down at the same time. So sort of a perfect storm, if you will.
Yeah, and it sounds very similar, quite frankly, to a lot of industries and medicine. I know in speaking with the American medical colleges and the Association of American Medical Colleges, there's a shortage of specialists. We can't get enough. David, what do we need to do from your perspective to incentivize people to become veterinarians? I mean, I haven't met a person who doesn't like a dog or a cat. They may not want a dog or cat, but I have not met anyone in my entire travels that didn't like animals. So there are people out there that want to do this type of work. How do we incentivize them to come to your school, go to school, to become a vet, to do the job, be a clinician?
Right, right. Well, fortunately, as a profession, there have always been more people wanting to be veterinarians than can be veterinarians. And what people don't realize is, we go through pretty much all the same training as an MD. It's very it's very selective getting into vet school. Until recently, there hadn't been an increase in vet schools in years. Now there's several new ones in the States. Over the last 10 to 15 years, most schools have increased their class size a bit. But those of us who have been in this profession for a while have seen that pendulum go back and forth a bit. There were big concerns coming out of the recession that there were way too many vets. Salaries were still way too low. Salaries, for the most part, haven't kept pace with inflation until just recently, really. And so, there are people that want to be veterinarians. The big challenge is going to be places in veterinary schools. You can't just open a vet school. Has to get accredited. It's again, you've got to be prepared to train just like a med school. And then there's at least 4 years before your first class will graduate. So it's a long-term process. Some schools have been able to increase their class size even a bit more. I think one of the other factors that limits our profession so much is our use of our veterinary technicians. Again, in human medicine, we rarely get to see our physician, right? We see a physician's assistant, we see an RN, a nurse practitioner, and honestly, that's okay for the vast majority of things we do. But that's not true in veterinary medicine, right? You almost always see your veterinarian. We're the ones putting our hands on the animal, and that's the way it's always been.
Yeah.
So,
well, David, go ahead. I'm sorry. Go ahead.
No. Well, so learning to and within veterinary technicians, some states have licensure for vet techs, so they're very much like an RN in those states, and they can do almost everything we can do under supervision of a veterinarian, with some big exceptions, obviously surgery and diagnosing. But many states don't have licensure. They'll train technicians within their own practice, take people who love animals off the street, and so it's there needs to be more coordination there and to find that paraprofessional level that can really help us with our work and get through a lot more patients.
Yeah, and David, he made that point that it's similar to being a veterinarian, similar to going to medical school for being a human doctor, but I would argue it may be even more challenging because you have to prepare to work with all different types of animals. We're one type of animal, there's the human, but then you're working with the horses, you're working with dogs, you're working with cats. It seems to me a lot more complicated because they each have different circulatory systems, respiratory. It's very different.
Right. Yeah, absolutely. And most veterinarians still are general practitioners, although a growing number of our graduates do want to become specialists. So then, like human medicine, they'll do an internship and then a residency, which might be another 3 years or more, to become a specialist in cardiology, anesthesiology, you name it. So, that's another factor that is stretching our workforce a bit. We've got specialty practices growing. We've got now telehealth. You mentioned telemedicine. So we've got a lot of veterinarians now getting involved in that. Most veterinary practices expanded their hours right before the pandemic. So, your veterinarian likely has Saturday hours, but many practices have Sunday evening hours. So that stretched the workforce now too. So all of a sudden, instead of 8 to 5, we have to staff our hospitals from, say, 7 till 11. So you've got urgent care in there too. So yeah, so a lot of things impacting it. I think yeah, and it's there's a pretty big barrier to entry getting into vet school, getting through vet school, getting licensed. It's a lot to learn for sure, and a lot of people don't realize that. So
yeah, but very rewarding. David, I need to take a very quick break. When we come back, we're going to talk about telehealth, the evolution of veterinarian care, and a lot more. You're going to want to stay tuned right here on BRN AM. Imagine a new television network that will make you richer, healthier, and in control of your financial future. This network is for the policewoman in Nashville, Tennessee, the baker in Dubuque, Iowa, the teacher in Lexington, Kentucky. We want to make the idea of savings and retirement culturally relevant. But what do you see as a defining issue of the midterms, especially for the smaller businesses? I mean, they are the lifeblood of the American economy. Featuring exclusive interviews, current affairs, and docuseries. 33 years old, you retired early.
The philosophy is money only matters if it helps you live a life that you love.
But you got to start thinking about retirement as soon as you get in.
The Broadcast Retirement Network will drive very high engagement with premium partnerships. So this isn't retirement and savings for your parents or grandparents. This is for all Americans. And we're going to change the way you think about money. Welcome to the next frontier of retirement and savings. This is BRN, the Broadcast Retirement Network.
Tax audits, tax liens, wage garnishments.
Every day we hear stories like this about good folks who are simply struggling to pay their bills. Each of them are living a frightening IRS tax nightmare, and they are afraid it will destroy their lives.
I'm a divorced single mom, and my ex-husband left me and the kids with a lot of unpaid bills, including unpaid taxes. I was really starting to show my stress on my kids because the IRS had sent me a letter demanding a huge payment from me. I couldn't afford it. So then the IRS was threatening to garnish my wages. I'm already living paycheck to paycheck. That would have put me over the edge financially.
It truly seemed hopeless, but then a friend at work told her to call the tax relief line.
The people at the tax relief line, they told me about something called innocent spouse relief. They worked it out so that all of the taxes from my ex are not my problem. I don't know how that works, and I don't care. All I care about is that I don't owe the IRS a dime, and they are not going to take my paycheck.
Even if it seems hopeless, you should call the number on your screen right now. There is absolutely no cost for the call or the consultation. You are under no obligation. If you are worried that the IRS could garnish your wages, seize your assets, even take your home, call us right now. The Tax Relief Line is here to help you. Now you have a knowledgeable, professional team of tax experts that are ready to negotiate with the IRS and fight for you to save you money. The Tax Relief Line's professionals have successfully negotiated thousands of cases, reducing and sometimes even eliminating the tax debt for their clients. It's very easy to get started. Simply call the number on your screen right now. You don't have to live in fear anymore. The call and the consultation are free.
Well, David, thanks so much for sticking around with us for segment number 2. Really appreciate you joining us this morning.
of course, yeah, great questions. Thanks.
Yeah, let's talk about telemedicine, because many of us during COVID had to go to the doctor. We didn't go physically to the doctor. We did it through telemedicine. So is that available for our pets, and how does it work? Because I can't get Fido to sit still in front of the computer. But how does it work?
Yeah, that's a great question. And you really hit the nail on the head in terms of, one of the biggest obstacles to all this, right? Our patients don't talk to us, and we can't necessarily rely on the owner to notice all the little idiosyncrasies that might be going on with that patient. Most state practice acts, which govern how we practice veterinary medicine in those states, is based on the client-patient-doctor relationship. So us putting hands on the dog and cat and being able to diagnose with the information from the client there. So, and that's harder to do with telehealth. So obviously though, with during the pandemic, most states actually relaxed things a little bit to allow us to do a little more through telehealth than maybe we would have in the past. For example, to refill most prescriptions, if we haven't seen the patient within 6 months to a year, depending on what kind of drug it is, we would have to see them again. We had a little more latitude in many states to be able to stretch that a little bit just because of the emergency situation. But now the profession is wrestling with that, and it's going to have to be done kind of state by state because that's how the practice acts are decided. I think for up until the pandemic, this wasn't something that was really a burning platform for us. I think, right or wrong, we've always been a profession that's pretty traditional in how we've provided care. But I think now, and we're seeing the demand and unable to keep up, that I think most veterinarians would actually embrace telehealth now rather than see it as kind of the scary new entrant or competition. So
yeah, I mean, there's nothing that can replace being in the doctor's office, having him or her look at you physically and taking your blood work and doing all those things. But it seems to me that if it's not being a layperson, it's a good medium step, especially if we've got a shortage of vets. I mean, the last thing you want is a sick dog, cat, horse, lizard. I don't want to give short shrift to our reptile friends, but it seems to me that and it might be a good way from a practice building perspective to build your practice. You talk about monetization, economics. That's an important part to any business.
Right. Well, where that's going to become more important is in the rural communities, because it is getting much more difficult to find new graduates that want to go into rural communities. Sometimes there you have to provide your own emergency care. Sometimes you're doing large animal, small animal, which maybe seems really romantic initially, being the country vet, but it's one of the most demanding types of practice there is. And it's getting hard to find people that want to do that kind of practice. Plus, we don't have as many applicants from rural communities anymore, so it's harder to get people that then want to go into the country. So
yeah, it's so interesting how this mirrors our healthcare system, because that one of the big challenges also is rural hospitals and rural medical care, because as you said, there's not that opportunity. A lot of hospitals have closed down or merged with others. David, last question before I let you go. What can we do to keep our pets healthy in the interim while we're waiting to get a veterinarian visit? If we can't get one right away, what can we do? I mean, there's obviously eating the right foods, exercise, but what do we do?
Yeah, no, great question. Probably the most important thing you can do is keep up on the preventative care as best as possible, and that does mean getting in for a wellness visit at some point, and that's something vets can do a little faster. And then, as you said, feeding the right food that your veterinarian recommends, and whatever else your pet needs. That was another problem in the pandemic. By the time we saw the patient, they were sicker. They might have, and it was going to be a lot more expensive at that point. So keeping on top of it, finding information online can help. We always appreciate clients that come in pretty well educated, and Cornell has we have our canine and feline health centers that have information for owners. So I encourage you to check that out. And the other thing too is if something between telehealth and traditional practice is teletriage. So now there are some services for a pretty modest fee that you can talk to a veterinarian, explain the situation on the phone or on online, and they can tell you, is this an emergency? Do you really have to go, sit for 2 hours at the emergency clinic on a Sunday? Or is this something that can wait until Monday? And they can give you some ideas of what to do at home, obviously without diagnosing and prescribing. So there are definitely some things you can do to take a little more control and relieve some of the pressure on the veterinarians in the process. So making sure, it's important if you go to emergency clinic, we'd rather have true emergencies there, because that's what they do. And so having a bunch of animals there that maybe don't really need emergency service is not in anybody's best interest. So trying to figure out a way to satisfy the urgent care group.
Yeah, well, really important. I mean, we all love our pets, and for many of us, our pets are like our children. I think of our cats. My mom has a horse. We think of them like children or siblings. David, we're going to have to leave it here. Thanks so much for joining us. Good luck with everything, and we look forward to having you back on the program again very soon.
Anytime. All right. Thank you, Jeffrey.
And that wraps up this episode of BRN AM. Have a topic of interest, someone you think we should talk to, drop us a line. And don't forget, for all the latest curated news in lifestyle, wellness, finance, tech, so much more, all in one place, check out today's edition of our daily newsletter, The Morning Pulse. Want to search our archives, check out our latest content, or visit our website and, of course, all of our streaming partners. We're backing in tomorrow for another edition of BRN AM. Until then, I'm Jeff Snyder. Stay safe, keep on saving, and don't forget, roll with the changes.
But if you're tired of the same old...
Now is your opportunity to co-create content around any topic on the first lifestyle and wellness network. Reach a global audience through our platform and co-own exclusive branded content. All of our programs are available on demand and also as audio-only podcasts, so you can take us on the go. Broadcast Retirement Network, available anytime, anywhere, and on any device.